What do I need to know about dizziness, vertigo, and concussion? Dizziness and vertigo are two things that people routinely seek medical care for. But these are also very frustrating because most often you go into the emergency room or you go to your provider and testing is done, but it comes back as normal. MRI doesn't show anything, CT scan doesn't show anything. You may be sent for a round of trial physical therapy. In my experience, it may or may not help. Often it doesn't help. Now, there's a common type of vertigo called BPPV, benign positional paroxysmal vertigo. This is about the inner ear crystals. This is fairly common, but it's also the one that's most likely to be checked. Now, the other reasons for having dizziness are way less likely to be checked, and it's going to lead to people suffering way longer than they should. That's where a concussion comes in. Concussion is a form of traumatic brain injury, and it's the #1 cause of death and disability under the age of 44. There are two functionalities within the brain that really tend to take a hit with concussion. One is that your eyes don't do what they should. So your ability to focus, concentrate, track objects, and have that attention in the way you should is off. Whenever your attention is off, your brain isn't getting good signals, which means it has to paint a different reality than what may exist. The other thing that happens is our balance system, specifically our vestibular system, is off. This is our inner ears, but it's also much more centrally located as well. So anytime you turn your head, you go up an escalator, elevator, anything like that, it is activated. If this system is not healthy, it will make you feel off as well. So there's a way to evaluate both of these using eye movement testing and specific balance testing to identify which one, or if both of them are playing a role in your vertigo and dizziness. As you look for both, you are then able to get a treatment plan that works for you. So if you are dealing with ongoing vertigo and dizziness and you've got a past concussion, even if it wasn't ever diagnosed, this can be caused from car accidents, slip and falls, sports. It can haunt you today, even if your last one was 5 years ago. Your brain did the best it could to compensate, but it can only compensate for so long.